Hi, my name is Maximus, and today I'll be discussing my patient, Ben Johnson. Ben Johnson presented to the emergency room with a slurred speech and altered mental status. Although he appeared intoxicated, his blood alcohol level was negative. Upon further assessment, we found that he had a blood glucose level of 497 and diagnosed with diabetic ketoacidosis, or DKA. He was later diagnosed with type 1 diabetes mellitus, which explains the sudden onset severe hyperglycemia. Type 1 diabetes is an autoimmune disease where the body destroys insulin-producing beta cells in the pancreas, resulting in too much insulin production. Without insulin, the body breaks down fat for energy, producing ketones and leading to metabolic acidosis, which causes Ben's DKA. From a pharmacotherapy standpoint, DKA is treated with IV insulin, fluids, electrolyte replacement, especially potassium. Once stabilized, patients transition to a subcutaneous insulin regimen for a long-term management. For blood glucose control, normal target ranges typically between 80 to 130 fasting and 180 milligrams per deciliter after meals. So Ben's level of 497 is significantly elevated, which indicates severe hyperglycemia, which requires immediate intervention. Based on Ben's weight of 168 pounds or 76 kilograms, his estimated total daily insulin would be approximately 0.5 units per kilogram, which equals around to be 38 units per day. This usually is divided into basal and bolus insulin, with about 50% basal and 50% bolus insulin for meals. So that would mean around 19 units of basal insulin and 19 units of divided across the meals. For nutrition therapy, Ben will need to establish a consistent carbohydrate diet where carb intake is balanced with insulin dosing. So education on carbohydrate counting, blood glucose monitoring, and meal timing would be essential for him to continue to manage his condition. Weight bias may be present, and healthcare providers assume that Ben's condition was due to poor lifestyle. However, he was diagnosed with type 1, so it is not the cause by diet or weight, but by his autoimmune process. Making those assumptions would negatively impact care. As a nutritional professional, I would promote a non-judgmental, patient-centered approach and focus on clinical indicators such as blood glucose, insulin needs, and nutrition intake rather than just his weight alone. I would also advocate for an appropriate diabetes education to be provided to him within the healthcare team. When counseling Ben, I would use motivational interviewing with the use of open-ended questions like, what do you know about managing diabetes? And helping him build confidence with managing his blood sugar, food intake, and insulin use. I would also ask him, how do you feel now being diagnosed, and what challenges do you expect to see going forward? And how can I best help you mitigate those things? So one strategy to reduce weight bias is using weight-inclusive approach that focuses on behaviors rather than weight. The research done by Pohl et al. 2021 shows that weight stigma in healthcare setting can negatively affect patients' outcomes, reducing engagement in care, and it also increases stress, with highlighting the importance of respectful weight-inclusive approach. In conclusion, this case highlights the importance of insulin therapy while also giving nutritional education to a person that has been diagnosed for the first time with type 1 diabetes, while also giving a supportive counseling role and addressing weight bias within the healthcare. So thank you so much.